That interval training is an excellent method for getting in that great physical shape. Now, there's several different types of exercise that we cover in the book. Okay. Now, the first thing what we want to do is make sure that before we do any exercise that we go through a regular stretching routine. The one that we have in our V-core exercise or our warm-up stretching exercise is perfectly fine. It's a good generalized stretch just to get you warmed up. Throughout some of the other exercises that we do, and especially in the Gen Intensity series, you'll see that periodically we go into certain stretches, not only to cause your body to become flexible, but to also cool down the body. Now, it's imperative that you stretch so you can warm up the muscle, that you can get that muscle blood supply, get the tendons and ligaments that are controlling the range of motion in the joints to their maximum range, so that when you're going to exercise, you're not forcing, because your brain is going to tell your body to move. But if the muscles are not warm and the ligaments are not stretched and the tendons at the end of the muscles are not stretched, what's going to happen is you're going to pull a muscle. You're going to cause some of the fibers of those muscles to actually get torn. And if you start tearing muscle fibers, or if you push it too far and you tear some parts of the tendon fibers or even ligamentous fibers, the injury could be, not debilitating permanently, but it can knock you off your track for a week, 2 weeks, even 3 weeks period of time. So it's always important to stretch. I mean, I know even for myself, at the time of this recording, yes, I'm 51 years old, and I have to stretch. There's no way I could, if I see the young guys out there playing ball, I want to run out there and play, and they say, "Hey, Doc, come on, we need one more to make a 5," and I said, I can't. I got to spend that time stretching this body of mine, because my mind may be 20-something, but my body is still 50-something, and I have to physically warm that body up so I don't end up, debilitated. And believe me, I've done that, and I don't ever want to do that again. And I never suggest that you do that. So it's always important to get that body warmed up and stretched properly. Now, the next type of exercise is our cardio exercise, and that is getting your heart rate up to a certain level. And there's a number of formulas that are used, that you calculate a certain number, you subtract it by your age, and there's even more complicated ones. The simplest way to do it is this. When you go to say you're going to the local health club, and you're getting on the machine, you'll see that level that you feel comfortable at. When you get your heart rate up, you don't have to get it up to 150. If you're at 150 and you shouldn't be there, you will know it, because you may even pass out. You want to slowly get your heart rate up. And remember, whenever you're doing something that's going to be cardiovascular in nature, you're going to get your heart rate up, make sure you're physically fit to do this. Don't just say, "Oh, I saw Dr. V's tape and I'm going to run out there and I'm going to go jog a mile around the reservoir," or whatever, and then next thing you know, they're planting you on the ground because you're not able to do it. Make sure that you get a physical checkup, that your primary care physician or healthcare provider examines you, gets a good understanding of your family history when it comes to your heart, your cardiovascular system, because this is not about getting sick or hurting ourselves. This is about getting in shape, okay, in good physical shape, not dead physical shape. So you want to be able to make sure that you're physically fit to exercise and get that body's cardiovascular system up. Now, once you start getting accommodated to that, and say you could get your heart rate up to whatever that number is that you're sort of pushing it a little bit, then you can start advancing it and doing interval training on that treadmill or other aerobic exercise device. Now, the only other way to check your heart rate accurately would be to buy a cardiac monitor, which you wrap around your chest, and it monitors your heart rate, and you can actually see it on your wristwatch what your heart rate is. Yes, you can take your fingers and you can put it on your radial pulse and try to count the pulses and watch a clock. Not that accurate, okay? Or you could be a real knucklehead and try to find your carotid artery and press around far enough until you start passing out because you've knocked off the blood supply to your brain. I don't suggest that either. Do it smart. At the gym, monitor it, because just about every treadmill or elliptical machine or these other types of aerobic machines, they all have cardiac monitors, or you get the cardiac you get the pulse monitor that you put around your chest, and you can watch it on your wristwatch. And it's simple training methodology. You get your heart rate up to a certain number, let it drop a little bit, let it go up a little bit, drop a little bit. Interval training, excellent idea to do this. On the website, we'll have a couple of areas where you can see different ways or different formulas that you could use in order to get your ideal or your target heart rate when you're exercising. The next one is sort of, and I mentioned this several times about the interval training, but not only do you interval train when you do cardiovascular, okay, meaning that you have your treadmill and you either pick up the pace or you pick up the incline, but one of the things I like to do is a combination of both physical fitness, cardiovascular. So for example, it's like, and you'll get this mainly when you're looking at the gen intensity, but even when you're doing the 20-minute exercise, you'll notice that it is a combination of a number of things. Because if you do that exercise straight across for 20 minutes, it will be cardiovascular. It'll also be interval because we have some periods of stops, like sort of breaks in between the exercise. But what you notice is that we change the exercises around, and that's one of the things that are kind of cool. So a lot of these training tapes now that are very popular on TV, they're excellent training tapes, and I've seen a bunch of them. They work really well. The science behind them is good. A lot of times, though, we get a little bit carried away. We see the model or the fitness trainer on the brochure cover, and you say, "I want to be like this person." You're not going to be like that person. You want to be a physically fit version of you, okay? You don't need to be that seriously muscular person or that person the woman who could fit into any dress size type of person. You want to work on the physically fit you version, okay? And that's going to take work on your end. Just looking at a picture is not going to get you there. So, when we're doing the exercises, like one of the exercises that we have, you'll see that you may be running in place, then you get on the floor and you're doing push-ups, then you're running in place, then you're on the floor doing stretches. That's an interval training too, because you're mixing up the exercises and you're mixing up the paces and the speed of the exercise. Now, another version of exercise, of course, is endurance training. Now, endurance training, and that's not what we start off initially, because if you have not exercised before, your endurance is going to be 0. So as we start getting more physically fit, you may want to mix up your exercises during the week. And endurance is, if it's going to be through weight training, it's going to be light weights or lighter weights with higher repetitions, okay? So if you're doing some type of bench press exercise, or you're doing a shoulder exercise with the weights or on the machine, and say the maximum you could do is 100 pounds and you do about 5 reps, if that be the case, what you're going to be doing is building muscle in the shoulder. You're going to be building muscle mass, okay? You're not necessarily going to be building endurance in the muscle, but you're going to be building size of the muscle or strength of the muscle. Now, if you take that same exercise and instead of using 100 pounds, you use only 20 pounds and you're lifting it up, and you do 100 repetitions of it, yet muscle's going to be sore, it may not increase its size or may not be part of the protocol that's necessary to build the bulk of the muscle, but you'll build plenty of endurance in that muscle. So that all depends, what kind of, especially if you're competing in sports, what kind of sports you're competing in. Is it a strength sport or is it a repetition sport? And then the other obvious end of endurance is just like if you're on a treadmill or an exercise bike and you're just doing it for a long period of time at a pace where your heart rate is up and you're in some type of fat burning mode. Okay, so if your resting heart rate is, say, 73, okay, and you're on an exercise bike at 98, it may not be breaking the biggest sweat in the world, but if you do it for a long period of time, you're actually building some endurance. Like I mentioned before, the strength training, that's strictly when you're going to be using either free weights or exercise machine weights, or even your body weight, okay, where you do a low number of repetitions, like something 8 or less, and by the time you get to the last one, you've got the veins popping out of your head, you're starting to spit. That's a good sign, because you're at that point, you're actually, well, it sounds terrible, but you're actually tearing muscle fiber, allowing that muscle to replenish itself, rebuild itself, add stronger, larger amino acids chains in there. It's called actin and myosin. It's like a chain, like a gear effect inside the muscles, and it actually elongates and swells, and it creates a larger, stronger muscle. Okay, now that's good. Some muscles that you need to have stronger, or if you want to just work on your physique, it's definitely a viable, a viable choice of what we're working on. The next one is building on power exercises. Now, power exercises is any exercise you do that has a thrust to it. So just squatting down and jumping, okay, is a power exercise. Going down to do a push-up and pushing off is a power exercise. It's a power exercise in your pectoral muscles. When you're down in a squat position, you're jumping up, it's a power exercise in your calves and your quadriceps. So any type of exercise that you could load the muscle and poof, burst out of it, that's going to be a power building exercise. And you can do it with a number of different types of equipment or apparatuses. I know I sometimes have the heavy medicine ball at the gym, and just throwing it straight up builds power in the shoulders, in the deltoid muscles. And at work, I'm not on video constantly. I'm actually taking care of hundreds of patients every week. I need to keep myself fit, and being a chiropractor and adjusting this many people for 25 plus years, you need to have a balance of all types of these muscle training formulas or methodologies, and power is very important, especially just in everyday work. But that's your power exercise. Then the last one that we want to speak about is just balance exercises. Now, when you're doing that lunge, you notice how your body wobbles a little bit. That's a good sign. It's not a good sign if you're doing it for a month, but it's a good sign that you're incorporating your abdominal core muscles. So certain exercises where you're bending down on one leg and you're picking yourself up, or you're standing on one leg and you have your arms out, or picking your back leg up and stretching out your quadriceps, those are all good exercises that require balance. Even when you're watching the Gen Intensity tape, we have a whole 15-minute segment on our Gen Intensity Max Balance tape, where we're doing exercises and trying to balance, jumping and landing on one leg softly, trying to keep a steady pace. It's very important because your core muscles, your ability to be steady, your ability to resist force against you is completely predicated on having a strong balancing abdominal area and other core muscles that go along with it. Okay, so just as a recap before we finish up, what I want you to do is always set a goal of the number of calories you want to burn each day. Okay, and some of it may have to do with the fact that you want to get to that 1,200 point differential. I would say a minimum of trying to burn anyway, especially starting off 200 to 300 calories per day. And there's a number of ways that we can figure out how to do that. But the easiest way is to get a device or if you're at the gym, it'll measure what that activity is. So the simple, for example, is this. Is if you say you were on the treadmill for 10 minutes and you burned 100 calories and your average heart rate was 110, okay? So you'll know from now on, whenever you do 10 minutes of work and your heart rate, if you measure it, even if you're measuring it by your finger, is 110 beats per minute, in that 10 minutes you did burn 100 calories. So you could do the mathematics backwards once you get that base level. So I hope you understood what I'm saying is you could measure it on a device and then take the variables out of it and put some given numbers in it. Like, for example, 10 minutes of work at a certain heart rate, the machine said you burned 100 calories. That means when you do 10 minutes of work on anything where you get the heart rate up to that number, you burned 100 calories, okay? But we need to set goals, get to those goals, work on those goals, supercharge your body, exercise every day. Don't be a quitter. Don't come up with an excuse. Listen to this this segment. I'm thinking I'm on DVD, but I'm sitting in your room here with you. I'm in my room and you're in yours, and we're working hard, both of us. After this, I'm going to go do a little bit of exercise because I motivated myself, okay? See you at the next segment. See you next week. God bless. We're moving forward and getting strong.